So welcome back to our video, and today we're going to talk about the most commonly asked questions regarding dental implants. So let's get started in this video. So the next commonly asked question is, how long generally does it take to get a dental implant? The first appointment is generally the consultation appointment. This is where you and I sit together and we will talk about the different options of replacing the missing single tooth or multiple teeth or the full jaw with dental implants and the different kind of options that are available. Once we come to a consensus and decide that this is the kind of treatment plan that we are going forward with, the next step is to get a cone beam X-ray to establish the fact that we have adequate amount of bone available for us to do all the procedures to give you the results that you need. The general time that an implant takes to heal and integrate within your bone is anywhere from 2.5 to 3 months. So the process from the consultation to getting your final tooth is generally within the range of about 3 to 4 months time. If additional bone grafting procedures are performed, then we might need to wait for some more time, which can be anywhere around 4 to 6 months, for that bone to integrate and form new bone so that the implant can either be placed or the implant can be loaded once the healing has occurred. Coming to our next commonly asked question, which is, once you have your dental implant and the crown in place, what can you as a patient do to take care of this dental implant on a day-to-day basis? The answer is, of course, your regular cleaning and hygiene procedures which you carry out at home, which can include brushing using an electronic toothbrush. Second, you can clean and floss the area between the implant and the natural tooth in the front and the back of it. Of course, if the spaces are larger, you can use something that's called as an interdental toothbrush or a water pick so that no gum infection occurs around the implant or any decay does not begin in the tooth in the front or the back of the dental implant. A mouthwash can also be used as an adjunct to clean the tooth of the dental implant. The next commonly asked question is, what is the age limit for getting a dental implant? Nowadays, because of the increase in life expectancy, dental implants can be placed at a very later age, even in your late 80s, early 90s, provided you are physically fit and able to withstand the dental implant procedure. On the contrary, when we are thinking of placing implants in kids and adolescents, we have to wait for at least up to a period of 18 years so that the growth phase of the child is complete. The next question is, are dental insurances covering any sort of dental implant procedures? Unfortunately, in India, dental implants are not yet covered with dental insurances and they are a completely out-of-pocket procedure. Since they are an elective procedure, most insurance companies do not cover dental implants. That said, if you're working for a company that has some sort of a dental insurance coverage, it would be great for you to ask them if any sort of reimbursement or any part payments towards these kind of dental implants are approved by the company. Coming to the next commonly asked question is, can dental implants fail? Now understand this, dental implants are made out of metal, so they do not decay compared to natural teeth. But because they are still placed within bone and gum tissue, there is always a possibility that dental implants can over time get infected, or there might be some sort of a prosthetic complication. As long as you're regular with your dental hygiene appointments and follow-ups every 6 months, your dental implant surgeon should be able to diagnose any such problems and help you out to immediately rectify such problems, provided that you show up within the time frame. Any extension or delay within these infected implants can lead to complete loss of implants also and might require the surgeon to remove the implant and eventually replace it with something new. This requires not only more time but also money and can be quite tedious to perform. Therefore, you should always make time to visit your dentist every 6 months and ensure that your dental implants are in good health. Coming to our next question, most patients have some sort of a gum disease that need dental implants. They've lost their natural teeth due to some sort of gum infection, inflammation, or commonly known as periodontitis within the dental fraternity. Periodontitis, to a certain extent, is treatable and controllable. But once the periodontal disease extends to severe bone loss, it is always advised that these teeth be extracted in time so that the remaining bone around these teeth can be utilized to place dental implants. The survival rate of dental implants in patients with gum disease has been shown to be very successful even in scientific literature. So I hope this video was helpful, and we will come back to you with more information, especially about dental implants. If you haven't already subscribed to our channel, please make sure that you click on the subscribe icon below and are always updated about our new videos.